Hello from Gutology HQ in today's episode of the Gutology podcast. Julia is joined by James Goolnik, a dentist with over 25 years experience who's redefining oral health through a functional whole body approach. We'll take a dive into how oral care connects to gut health, sleep, inflammation and long-term well-being, why supporting the oral microbiome is more effective than sterilising it, and how simple lifestyle shifts from breathing to nutrition to daily oral habits can make a powerful difference. Plus, James answers listener-submitted questions on gun health, grinding, snoring, and more.
Hi, James. Thanks for coming into the studio today. It's lovely to see you.
Thank you for inviting me. I'm excited.
Good, me too. So, shall we start? Would you like to introduce yourself for the Gutology listeners?
Okay. Hi, I'm James. I'm a dentist. I've been doing it for 32 years now, and really excited every day to see patients and get them healthier. For me, I had one clinic that I've been involved with for 25 years, and watching families grow up and seeing the impact that oral health can help on their diet, on their energy levels, on their sleep, on the development of what's happened with their family has been amazing. And actually, one thing is, when we first started, it was all about drilling and filling, and realizing that actually there's loads more to dentistry than that, and realizing that can have a bigger impact, just not on their oral health, but on their whole body health. And it's been really exciting. And being a father of 3 kids, it's been one of these things that actually seeing how my kids have developed and grown, and realizing that there's more to life than just saying don't eat sugar and brush your teeth. And that's what was being told to us at dental school when I qualified 30 years ago. It was like our nutrition advice was don't eat sugar. That was about it. And sugar causes tooth decay. And when we get tooth decay, the best thing the dentist can ever do is drill in your tooth and put a filling in there, and an amalgam filling full of mercury, because that was the best thing that there was around then. And interesting, it's only just been banned last year in the UK. I'm really excited to have a chat to you about oral health and how we can have bigger conversations and how we can have a bigger impact rather than just telling people to brush their teeth and don't eat sugar.
Yeah, it's so important to get these wider ideas out there. So was there any kind of real turning point for you in your practice? Was there sort of that moment or that patient or something that really thought this has got to go deeper now? Or was it just more of an evolving thing?
It's an evolving thing, but I've always realized that the impact that I can have on somebody's general health and wellness, and seeing people for a long period of time, I can spot to them that actually there's maybe a chance you're pregnant at the moment. And they go, what? And I go, I've been seeing you for 15 years, and I've noticed there's a change in your gums.
You can tell that in
yes.
your... Oh, wow.
So actually realizing that there is signs in the mouth that we shouldn't be ignoring, and realizing that actually we should be looking at that. And that's been fascinating, and realizing that makes a big difference. And then spending time with my patients, and actually they understanding that they shouldn't be snacking, they shouldn't be having loads of sugar and carbohydrates, but actually people know that, but can they do something about it? And then delving a little bit more into it and realizing actually there's no nutrition training in dentistry, and we need to do a bit more about that. And then starting to look a little bit further about it, and then realizing that actually we can't trust what the labels on the manufacturer's food, and ideally we should be eating things that don't have labels on, and realizing that actually most of my patients struggle with that, and how I can educate them in a better way to understand what's on the labels if they're doing that, but also helping them to cook from scratch. I read an interesting article I read in 2009, which was all about taste buds, and how the taste buds, they have an average lifespan of about 10 days. So every 10 days, your taste bud is replenishing. And really, if you can get somebody off sugar and processed foods for long enough, their taste buds reboot. And when they try things that are sweet, they go, wow, this is just too sweet. So trying to get people off that 10-day barrier of eating things, which was fascinating. And then that made me write a book called Kick Sugar, and giving people some ideas to how they can eat things that give them the whole flavor of things and not just sweet. And that's one thing that I'm really, really passionate about, and realizing that 90% of toothpastes have artificial sweeteners in them. So the first thing that we put in our mouths in the morning is sweet. So our taste buds are going, sweet things here. I want more sweet things. And then they have their desserts for breakfast, which is more sweet things. And then just suddenly they're craving sweet things and they're feeling hungrier and things like that. And that was something that I wanted to work on and try and give people the understanding of what they're putting in their body and how it has an effect on them, because it's very different. You may be having a chocolate bar and it causes no effect to you, whereas for other people will have the same chocolate bar and suddenly their blood glucose spikes massively. They get really hungry, they get irritable, then it starts affecting the microbiome and all the other things, and how everyone is different and how we can use these little tools to tweak things. And I think that's what's fascinating and what's brilliant about the oral space at the moment, but also general health is there's all these biomarkers that we're looking at, whether there's the oral ring, there's the sort of Whoop bands, Apple Watches, things like that, and people actually can mark their own metrics and actually see what is working for them, rather than just telling everyone the same advice to say, don't eat sugar. People know that, but actually there's a different way you can do it. And I think that's what's really fascinating for me, that you can actually start having these deeper conversations and give people sort of metrics so they can actually benchmark what's going on in their body.
It's interesting because I come from the nutrition and functional medicine side of things, and one of the first things we're always talking about in practice is the gut, obviously, because it's like the center of a lot of things in the body. But the beginning of the gut is the mouth. So we always say, right, what's your dental health like? Are you chewing properly? Have you got saliva production? Have you got dry mouth? What's going on? And looking at the shape of the tongue, has it got little grooves and cracks and things? But in the other side, on the dentistry side, like you say, there's not much nutrition other than avoid sugar. So it doesn't, it's sort of never added up. So it is really exciting that these worlds are they're colliding now. They are
people realizing that to get into the gut microbiome, you've got to go through the oral microbiome. So whatever you're putting in, and the oral microbiome is the second most diverse microbiome in the system, but it's so delicate and it can be so easily pushed off balance. And a lot of these manufacturers out there, especially for like mouthwashes and things, and ones that contain a lot of alcohol, it's about, let's just kill them, bugs are bad, let's just kill everything, nuke it all. And then we're getting people who are coming back with thrush or candida, they're getting bad breath, they're causing tooth decay, they're having really bad issues, and it's all stemmed down to the mouthwash they've been told, and they've been pushed on the marketing. It's like, just use mouthwash, you don't need to do it. If you haven't got time to brush your teeth, just have mouthwash. That is it, and it isn't it. And it's the biggest thing I try and get my patients off is any sort of mouthwash. For me, a mouthwash is a short-term thing. If you've got a mouth ulcer, if you've had some surgery and you're just recovering, short-term. And the best mouthwash is salt water. So it works really, really well. And you don't need any of these fancy mouthwashes to do it. But really, for most patients, I actually try and get them off things first. It's almost like I had a lady came in last week and she was on 121 supplements. And so she started down and it was like, she's listing all the supplements. And I'm taking vitamin D and K3. And she knew everything, NAD, everything, and the doses. And I'm taking this brand because it's much more bioactive than this brand. She's done all the research. And it's like, okay, so when was the last time you had your metrics and blood tests done to have a look at your micronutrient status and things like that? A couple of years ago. I said, well, you don't know if you're absorbing any of this stuff. And then you almost get into this cycle of, I'm too scared of stopping this one because I think it might give me something. But so I'll just add another layer and I add another layer. And suddenly they're taking 121 supplements. And it's like, okay, let's stop. Let's see if we can start paring these back and seeing what's going on and what are we trying to achieve here. And some people are just scared. And it's like, okay, that's one of our jobs, to hold their hand to say, like, okay, let's stop. The body is very complex, but it's brilliant at resetting and getting back. So let's just start paring things back and seeing what is going on. What's your sleep like? It's the biggest question we ask is what your sleep's like. How do you feel in the morning? Do you feel energized and excited for your podcast and ready to go? Or are you really tired and hit snooze button? And that's the biggest for us, is like looking at how people feel in the morning. It's like, okay, how do you want to feel in the morning? Do you want to feel excited? Is it your job? It might be the fact you're just feeling knackered because you hate your job. And it's not the sleep quality, it's the stress and the other things going on. And that's so satisfying as a healthcare provider, is actually working on the whole picture, looking at their stress level, looking at their sleep. And then things that we can do as oral healthcare providers of sleep is actually, first of all, we can diagnose sleep apnea and sleep disordered breathings. So really, you should be fully saturated at night. Your oxygen saturation should be 95% and above. You should feel excited and energized for the next day. And if you don't, there's something going on. It could be that you've got sleep apnea and you're snoring at night-hand side, and you're finding that when we fall asleep, our muscles relax and our tongue drops back and it blocks the airway, and then it reduces the oxygen that's going into your system, and then your body naturally is waking you up. These called these micro alerts. So every 10, 15 minutes, you're slightly waking up again because your body's going, oh, I'm starving of oxygen here. I've got an apnea, an event, and I need to get more oxygen. So how can I do that? So your body is keep micro alerts. So therefore, you never feel refreshed enough because you don't get your deep sleep. And I think that's really fascinating for us to start talking about that. And you can track it really easily with one of these sort of Apple Watches, things like that. Or we do overnight sleep tests. They're not expensive now. If you used to have to go to hospital and they used to go in there, wire you all up and put you in a strange hospital room with all these electrodes and go, sleep now. And it's like, okay, not quite easy as that. But now you can do it in your own bed. You have this pulse oximeter that goes in your finger. You got this little electrode that goes in your chest, and it works on your respiration rate. And then it can tell your posture, where you're sleeping, what side, and things like that. And I did one of these tests sort of 15 years ago, and I have positional sleep apnea, which means when I sleep on my back, my airway blocks and I start waking up. So a simple test for me was I just bought something from Amazon. It's like a wedge, goes under my pillow, under my sheets, and it means that I sleep on my side. And when in the middle of the night, when I start rolling over, I just hit this wedge and it gently coerces me back on my side again. And that was like £30 and fixed, no more sleep apnea. So they're really simple things for people that they can do, but actually having that conversation first with the dentist, like, how do you feel in the morning? What can we do? And that could be just a sleep test, or it could be that we make them a thing called a mandibular advancement device. It's basically like two mouth guards glued together. So you have one on the top jaw, one on the bottom jaw, and as you fall asleep, what happens is your jaw relaxes and the muscles drop. But because you're wearing these two appliances, it stops the lower jaw dropping back and actually blocking your airway. So it's a simple thing. You just pop in before you go to sleep, and you wake up in the morning, you feel 1,000 times better. And that's something that people can use all over the world. They can travel with and things like that. Because the alternative is like a CPAP machine, which is this sort of mask that you see like an astronaut type thing, and it forces air into your lungs to make sure that you have enough oxygen throughout the night. And most people find it a struggle to wear because it's a big thing. Also with their partner next door, it sounds like Darth Vader, that. And also it's not supportable. And people find it struggle a lot with that. They tend to get dry lips and mouth and things like that. So they have caused other issues as well. So I think for me, sleep is the sort of foundation thing. If we can get that right and we can get you recharging and working. So speak to your dentist about that sort of thing, because I think it's fascinating.
So for people that are on a CPAP and are not enjoying that,
yes.
There are other ways
Yes.
then. And would you say there are other ways for most people
Yes.
once they get that properly assessed and understood?
So it's having an overnight sleep test or something to see what is going on, because it might be something simple like positional, and you can fix it with a wedge or something else like that. Or it might be you're overweight, and then the fact is that the muscles around the jaw are not functioning as well and not as strong. So it might be that we send you to something like a myofunctional therapist, who's somebody that is basically like a PT for your jaw and your face. And they'll teach you how to breathe and how to swallow, strengthen the jaw muscles, and actually re-educate you to put your tongue on the roof of your mouth and get you to breathe through your nose, because most of us are still breathing through the mouth, which is causing an issue.
So what's the connection with snoring?
Okay, so we shouldn't be snoring, first of all. Some people, if they've drunk a lot of alcohol, they're more likely to snore. If they've had a meal just before bed, they're more likely to snore because of the digestion thing. But most of the time, we shouldn't be snoring. And if we are snoring, it shows that the airway is being blocked, and usually it's being blocked by the tongue. And we need to try and deal with that, because you're not getting the oxygen saturation as much as possible. So if you or your partner is snoring, I would first do a sleep test. You can do it with one of your devices. Otherwise, get a proper sleep test and actually see what is happening when you're snoring. And if it's only happening 10 minutes a night and your oxygen saturation dips for those 10 minutes and the rest of the time, not a problem. But if it is happening, and it's called an AHI, and it's basically how many times an hour that you're actually stopping breathing, and if you're getting higher figures of sort of 10 or above, then I'd be worried and say, look, there's something going on here. We need to work on that. And that could be then looking at one of these devices to try and stop your jaw dropping back. It could be myofunctional therapy, which is giving you workout and exercise and things like that to strengthen these muscles and teach you how to do it. For some people, actually, it's something as simple as mouth taping that you can actually do to actually encourage yourself to breathe through your nose. And I get patients all the time who are using all these different types of mouth tape, and they've seen it on by influencers, and they've seen it on Instagram or things like that. The thing I always say to people first is do it for an hour a day during the day. and make sure that you can actually breathe through your nose. Because if you've had an injury to your nose and you can't breathe through your nose, or you've got a cold, you're just going to suffocate if you put tape over your mouth, and it's not going to work. So I always say do it for an hour a day for a week. And if you can do that, then start doing it at night. And you'll find, my 11-year-old daughter, who's going to hate me mentioning her now, so I'm not going to mention the name, but she's mouth taping, and it is a huge difference in her energy in the morning when she's mouth taping when she hasn't. And my wife says to me, you forgot to put tape on last night, because she's like really moody at breakfast. I mean, like, okay, it makes such a difference. It's so instant that you can see a big difference. And so my job as being the dentist in the family is to put the mouth tape on at night to make sure she does it, even though she's 11 and she can do it herself. But that is my job.
So the way that you feel in the morning, is it due to that slight drop in oxygen, or is it due to the restlessness of that sort of micro awaking?
It's a combination of both. You need the sleep test to see what is happening with it, and then there's also a combination of, do you eat too close to bed? There's all the other things that we can work on with our sleep hygiene.
So I've noticed that's really triggered a thought. I've noticed this for years in practice. If people are taking digestive enzymes to support their gut function, they stop snoring.
Wow.
Why is that?
Wow. I wouldn't get that. I've not heard that before.
Yeah.
Is there any evidence on it, or is it just what you noticed?
It's observation. It's just when we've been working on gut function, and it's like, well, my wife has just said that this is amazing.
Oh, wow.
Because they stop snoring and they no longer have to be chucked into the spare room all the time.
Nice.
But it's time and time and time again. And so now if I get snorers, I know exactly what to do.
Wow.
Take it even if you don't have a gut issue.
Okay.
And it's almost an instant effect. I think that's what's great about things like the snoring and the sleep apnea. When you know you've got a problem, you can identify it quite easily. But also, once you've modified it, some of them are quite simple fixes by the sound of it.
Yeah, a lot of the fixes are simple and quick as well. So mouth taping, you're going to notice it within a night. Yeah. So it's very good. Obviously, if you're overweight and we need to work on that, that's going to take a bit longer to do it. But there's so many evidence now on sleep apnea and long-term cognitive decline and Alzheimer's and all these different things that people then, when they hear about Alzheimer's and they think, okay, you know what, the snoring, most of the people, the snoring doesn't bother them, is their partner. Their partner is going, you've got to go out of here. You've got to go and see James because I've had enough of this now. This is too much. It's the partner that's often doing. And actually the partner's saying, actually their sleep quality is being affected and they're moody in the morning and they're getting bad breath and they're having other things because of that. So it's like, to save marriages and rather than everyone having spare bedrooms, it's like, let's make mandibular advancement devices. Let's speak to a dentist about it. Let's try mouth tape, myofunctional therapy, and do the exercises and help that, and also help kids earlier on, because if the best device and the best orthodontic appliance there is your tongue. The tongue is a really powerful muscle and it works at making sure your airway is developing, your jaws are developing properly, and if you're breathing through your mouth the whole time, your tongue is not doing its job. And that's the thing. So if we can work on that and work on exercise and things like that, eventually people will not going to need orthodontics or braces, because gone are the days where we just take teeth out. We used to, everyone comes in, it's like 4 teeth coming out, you're having braces, you're having train tracks, that's it. You're going to be bullied and you're going to have a real hard time for 2 or 3 years, and then you're going to have straight teeth. But actually what we realize now is that that was causing a disservice to people. And actually if we can harness the growth and harness the function of their tongue and their airway, that the jaw will naturally expand. And that's what we're going to work on, and teaching people to chew, because that's the other thing, is people inhale their food. They're having these soft processed foods, they're eating in 30 seconds, watching TV, and they're not using these muscles. So the muscles are not developing properly, therefore they're not as strong, and therefore we're not breathing and swallowing properly, and therefore we're having other issues as we get older. And we know as we're younger, you can get away with a lot of stuff, but it catches up with you eventually, and that's the biggest one that we're catching up with is airway. So we're getting people now earlier and earlier to see the functional orthodontist and actually look at your tongue position and your posture, your swallowing, your breathing, and simple exercises that we can do, and or simple expanders that we can do to expand the arch to give it more space for the teeth to come through, so we don't need to take teeth out, because no one wants to take a tooth out.
So are we talking this sort of early teens here? Is that
no, we're going early. We're looking at
earlier?
6 and 7. When basically when the adult teeth start to come through, we need to know, is there enough space for them? Are the jaws growing and developing properly? Are they breathing through their nose, or are they mouth breathing? And can we do something about it first? And that will be then myofunctional therapy or taping or exercises, or it may be wearing an expander 8 years old to try and expand the jaw. And sometimes it's just wearing it at night initially just to get enough space to move so the teeth come through. So then we don't have to do anything else younger. And I think probably 50 to 100 years from now, there won't be orthodontics anymore. It will be more about we're working with the body to try and actually do its own thing. And I think that's the exciting thing about functional dentistry and medicine, is that we work with the body. Let's start seeing what the body needs rather than what you think it needs. And that's testing. And that's the biggest thing I do with my patients when I first see them. We go through a lot more questions and ask them about their energy, their hydration, their movement, things like that I want to know about. And they go to me, why are you asking me about that? It's like somebody comes in and their dentist is giving them a mouth guard for clenching and grinding. Okay, why are you clenching and grinding? What is going on here? Is it stress in your life? Is there something going on there? Is it actually micronutrients? And I've got patients that are zinc deficient and they're clenching and grinding because their muscles are hyperactivity. And if we can then work on the zinc, replenish it, they stop clenching and grinding, and they don't know where the mouth guard. So it's rather than just doing a plaster on the top of it, it's like, let's look back at the root cause. Let's go back and back and back and back and see if we can find what is being going on. When did it start? What is going on? It might be it's stress related, and it's like, okay, what do we do to reduce stress? Because we know when we're stressed, we make poor food choices, and therefore then it cycles through there. The sleep's not as good, things like that. Or what do we need to do? What do we need to put in our toolkit for them? When I know every month that I have a meeting with my boss, and that causes stress, I don't sleep as well. Okay, what can we put in place during that time? Let's make sure we do some food prep so we've got the best food, that we don't have to snack on rubbish. Let's increase our gym going to, so like we're going to block in a personal training session, or we're going to book a yoga session or something, and we're going to pay for it, so we're accountable for it. And it's like, okay, what can we put in place to try and minimize the impact of the stress that's going on? And then long term is the job the right one for you? And again, my wife's a psychotherapist, so she works with some of our patients on that. Can we work on that? And that's the biggest sort of satisfaction for me as a dentist, is actually, can I help them in the wider thing rather than just fix a tooth? The worst thing I can do is when I've been seeing you, Julia, for like 2 years, and you come in and you've got a cavity. It's like, I failed, okay? I've obviously not educated you enough on food and nutrition, or you've been stressed and things have changed in your microbiome, or you've not been taking your vitamin D and everything's changing, or what's going on that led you to needing that cavity, because I don't want to do it. So for new patients, I find a cavity, we fix it, and then we look back at why, and we try and educate them about why they're having tooth decay, what's going on. Again, that could be testing. That could be looking at history, family history of things, looking at their habits. So we do a food diary and actually see at 3 o'clock every day they have a packet of biscuits. And it's like, are you hungry at 3 o'clock? Are you bored at 3 o'clock? What is the trigger to getting those packet of biscuits? And if we replace that with an apple or something else, would that work? Or we replace it with you just getting out of your desk and going for a walk at 3 o'clock for 10 minutes, and then, or ringing your friend or something, and does that make a difference? So it's like, what little micro habits can we help nudging? Because what I don't want to do is like sit you down and go, okay, these are all the things we're going to change. You're going to stop doing this. No. It's like, most people can do that for 6 weeks, and then they're going to go back to what they want. And I want to do lastable change for people, and that is just little micro nudges and saying, okay, this is what's going on, and what can we change about it? And I think the microbiome that we're going to talk about a little bit later on is a great tool for having those conversations. And what we've been doing now at Optimal Dental Health is we take swabs of all our patients when we first see them, and we actually put it on a phase contrast microscope in front of them on a big 50-inch screen, and they can see live what's going on.
Sounds
and
terrifying.
they go, wow, is that me? And it's like, yes, that is you. This is what's going on. And we're looking at the dysbiotic relationship. We're seeing all these spirochetes. We're seeing all this stuff going on, and it looks crazy. But it's fascinating because it's another tool. We don't charge for it. It's another tool that is actually, you can see live. Because same with all your testing you do a functional test, your genetic test or something, you don't get the results for 2 weeks. You don't know what's happening with them in 2 weeks' time. They might be going through a divorce. They might be going through busy times at work. They might have forgotten the conversation they had with you. And then suddenly they've got this test in front of them. And most of the time they can't understand it. I mean, some of the better tests, they've got sort of traffic light system. But again, when you see this red and you see like Fusobacterium nucleatum and it's high, and you go, oh God. And then they go into ChatGPT and look at what's going on with that. And they go, oh dear, that means my 50% increase of chance of colorectal cancer. And I thought, okay, I'm worried when they see the cancer word and they see that and they go, what I should do, and they start getting really, really worried. So it's like, how can we help educate people with different tests? And if you can do something that's live and show people straight away, okay, this is what's going on now, this is why we need to do something about it, and then motivate people into doing that. Because there's a weird thing in the UK, I think it's globally actually, is people brush their teeth, spit out in the morning, they see red blood, and they just put the tap on and they think that's normal. And that I just don't understand that, because if I washed my hands in the morning and blood came out, I'd be panicking. I'd be going straight onto ChatGPT and I'd ring up my doctor and like, what's going on? Whereas people seem to think it's normal for blood to come out of your mouth.
I think in terms of symptoms, if the symptom is just annoying,
yeah,
people think it's normal.
Yeah.
That's really my observation.
Okay.
So like IBS, for example, is a classic. They've got constipation. They only go to the toilet once a week, but because that's just annoying and it doesn't really give them any trouble. In fact, sometimes it can be more convenient to not even bother needing a toilet.
Okay.
Then
More
great.
productive at work.
And
yes.
exactly. And I think maybe bleeding gums might fall into that category of like, well, why does it matter? Like I just spit it out. It's not like I'm bleeding from the corners of my mouth all day long thinking about it.
If it's spraying on the mirror, then maybe they would.
Yeah.
But it isn't. It shows there's something going on. It shows disease. And for most people, it's chronic inflammation, and for most people, it's leaky gums. And you hear about leaky guts, but people don't seem to understand about leaky gums. And we're finding more and more oral bacteria that should just be in the mouth are coming up in distal sites. So they're finding, like you're saying, in a colorectal cancer, Fusobacterium nucleatum, it should be just in the mouth. It is a normal commensal bacteria, so we have these bugs in the mouth and we want these bugs, but what we do want to have is a nice healthy balance between them all, and they're all sort of symbiotic, so they're all helping each other out. They're helping us because they help break down micronutrients, they help dissolve proteins and things like that, and we need them. So we want them, we don't want to get rid of them, but what we don't want to have them is them to be ending up in places they shouldn't be.
So is that due to stomach acid deficiencies or things like that, like where they should be killed off and they're not?
Yes.
That's obviously a problem.
Yeah, so there's a big thing with the stomach acid, so that people are finding that they're not getting killed off, so they're going right through into the GI tract, and that is the issue. But the bigger issue that we're seeing is gum inflammation, bleeding gums, means that actually they can get through that barrier that there should be. So this barrier that is there is not there anymore in the mouth, so they actually go straight into the blood-brain barrier.
So we often, when we're doing a supplement protocol, which we do sometimes, and if people have got severe gut issues and they're malabsorption, things like that, then we say, well, look, take a little powder, pop it under your tongue, or a little liquid, hold it in your mouth, because the vascularization of the mouth is so significant. It will go straight into the bloodstream and go where it needs to go. So we say use that as a positive, but then obviously when we're looking at that and the proximity to the blood-brain, it's really significant.
So it's a positive. If they've got gum disease, it's going to go even quicker and straight in. Yeah. And that's the thing we've got to worry about, and realizing that actually we want to stop that leaky barrier. We want to seal it. And the great thing about gum health is actually for most patients, within 3 or 4 days, that barrier can tighten up. So it's all about microbiome. And for a lot of people, it's about how they brush and clean and get rid of the debris. So if you haven't seen a hygienist or a dental care professional for years, there's going to be usually a build-up of plaque, which is food and bacteria. So seeing a hygienist to clean it and disinfect it is a good start. But then it's actually learning how to keep that clean. And again, it depends on your microbiome. So we can do a salivary microbiome test. So we can do a much more detailed sort of shotgun metagenomics. So we can actually look at all the different 700 species of bacteria, protozoa, virus, and see the prevalence of it. And then we can specify to you and say, actually, this is what we're worried about here, and this is what we need to change. And that could be a course of probiotics or probiotics, specifically to harness one, to grow one more. It could be a mouthwash of some sort, so it could be something like chlorine dioxide or something that will target it.
But very short term.
Yeah, short term, we're looking at 5 to 7 days. It could be something like ozone therapy, so we use a lot of ozone, and you can get on Amazon things like ozonated olive oil, and that's just basically concentrated oxygen. And most of these bugs are anaerobes, they don't like oxygen, so we flood them with oxygen, we can break them down and get your body to shift them as well. But we want to close that barrier as quickly as we can, and then it's actually finding out what's the cause, what has been going on with it. And sometimes it's genetic, and some people have more type of there's a bacteria called P. gingivalis or Porphyromonas gingivalis is one of the ones for gum disease, but also that one is actually been shown to be in the brain as well in Alzheimer's. So we don't want that. So we want to see what the levels are first. And if you're somebody that has the ApoE gene or somebody who's got something cognitive decline or Alzheimer's in the family, then we're going to be even stricter with you.
So thinking of the cognitive decline
Yeah.
space and the significance of that
Yeah.
right now in healthcare. Apart from the inflammation,
Yeah.
what are the other connections with the...
So it's the inflammation, but also it's the fact the translocation of the bacteria that shouldn't go anywhere else than the mouth.
So the leaky gums.
The leaky gums and things are and obviously the blood-brain barrier, and it's the fact it's very close, and that is where, and we're finding plaque build-ups, amyloids, things like that, and all the work with Dale Bredesen is he's shown that these things are ending up in the brain, and they shouldn't be, and the only way they can end up in the brain is into the bloodstream. So they're getting into the bloodstream, and why are they getting into the bloodstream? Because there's leaky gums, or the fact that there's dysbiosis and the fact that it is overtaking. And that's the sort of thing that patients come to see us and say, okay, I've read about the work of Dale Bredesen or something. Read about his paper in 2016, which is looking at cognitive decline and early sort of onset Alzheimer's and what we can do. And he looked and found that there were sort of 36 different stresses on the body. And for some people, and I know you know more about this than me, about mold and mycotoxins, things like that, is that some people have 20 of these sort of stresses on the body, and they've been living with them for 20 years and have no issues at all. Then they move house to somewhere where there's mold, and that 21st stressor is then what pushes them over the barrier. So it's like, what can we do? What can we take away? And as a healthcare professional, we do, so the sleep apnea and sleep and snoring, that's the biggest one for us that we do with cognitive decline and Alzheimer's. We work on that first to make sure you're fully oxygenated at night. But then the next thing we look at is gum disease, and periodontal treatment is actually if you've got bleeding gums and leaky guts, then those bugs are getting across and they're translocating into the blood barrier, and we don't want to do that. So that's the next barrier that we work on the gum health. And then the last one is actually metals and metal toxicities. And some people, again, can have a mouthful of metal amalgams or gold crowns or something, and again have no problems for years, and then they suddenly have gum disease, and then they suddenly have a course of antibiotics which affects their microbiome, and then they go on and move somewhere that's got mold or mycotoxins, and that combination is enough to just push them over the hill.
So we're looking at the perfect storm, really, different for everybody, but
Yeah.
a lot of different factors that just gradually simmer under the surface until it's just that last thing.
That pushes them over, and then obviously stress is the overriding thing that we all have to deal with and work on. So it's like, how do we deal with that? So, and I feel really privileged to be working with that, and we've spent a long time looking at metals in the mouth, and I haven't placed a metal filling for 15 years now. However, when we've got an amalgam filling and our patients sort of ring up and say, I've got a metal amalgam filling, and I've watched Dale Bredesen's work, I'm worried, I want that filling out straight away. We first of all then have a look at them and to see what's going on. Does that filling first of all need replacing? Is it failing? Is there something that's showing that it's failing? Because the mercury is more released when we first put one in the first year, but also when you cut one out. And if you're listening and you have a metal filling in your mouth, and when you're taking it out, you've got to be super careful how you take it out. Because one, it's for the healthcare provider, it can be dangerous for them, but also for you. So you have to look at something called a smart amalgam removal. And there's an institute in America called the Institute of Oral Medicine and Toxicology, IAOMT. You can look on the internet and have a look. And they actually have a protocol for safe removal for the team and for you. It's called smart removal. And it involves using something like rubber dam, which is like a sheet of latex rubber, goes over the teeth. We seal it. We use high volume suction. And we also have a pre-removal protocol. So it's with NAD, it's with glutathione. We use high dose vitamin C, increase your hydration to sort of 4 liters a day, and go through and make sure, first of all, you're healthy enough to take it out beforehand. Because if we take it out when you're not healthy enough, it can cause more systemic issues going on. So we get you at sort of the healthiest we can get you in. We do the supplements, or we look at the food and nutrition beforehand. Then when we take them out, we're really, really careful when we take them out and go through the whole protocol. And we use chlorella inside the cavity. We use activated charcoal to sort of coat your mucosa to make sure everything, we're all covered in gowns and things like that. It's almost like going back to COVID days when everyone's covered. but it is a dangerous chemical. And then we would seal it, and we usually use something like a BPA-free composite resin or a zirconia or porcelain onlay over the top of it. So we're really careful when we do replace it, and we also make sure that people are as well as they can do when they're doing it, and that's really, really important. So don't freak out if you're listening to this and you've got a metal amalgam filling, but actually think about, okay, do you have any other systemic issues that's going on, and when is the best time to do it? And if people are worried, there's also mercury tri-test you can do, which is a hair, blood and urine test to see what your mercury level is generally, because if we're eating fish, we're going to be having mercury anyway on our foods. So it's just actually seeing what level is in your body at the moment, and is it the metal fillings that are causing the problems? And obviously, when they need to replace, and every filling has a lifespan, so when it's looking at replacing, how can we safely do it, and what is the best sort of most biocompatible material that we use? And we also do blood tests for some people. There's a test called the Biocomp test, which actually looks at every single dental material made to man and looks at your reaction to it. So it might say, actually, this is the best white filling for you. This is the best toothpaste for you. This is it. And it's brilliant at testing these different things. It's only available in the US. So we do the tests on a Monday, Tuesday, and FedEx over.
Is that a type of antibody testing? Like
Yes.
seeing if there's any reactivity there?
Yes, and it works really well. And you can look at titanium implants, so people are worried about metal in the mouth, and zirconia implants, and see what is the best thing for you. And it's like jewelry. Some people can't wear certain jewelry and have reactions to it. So that is the dental equivalent of what. For me, ideally, we don't use any materials. We use naturally your dentine and your enamel, and we don't touch your teeth. And we just look at that, and we look at hydroxyapatite and all these things. But if we're going to do per material, what is the best for you, and what is the one that's going to last the longest?
So if they've not been exposed to these dental materials
Yeah.
before,
Yeah.
and it's an antibody type of test,
Yes.
what kind of is the logic really in terms of how do we pick up if they haven't had it in their body yet?
If they've never had it in their body, then yeah, if they're completely free of restorations, then I don't recommend doing the test, because
Right.
we don't
That
know
makes
if that's
sense.
going to do it. But we're really careful. So Optimal Dental Health, we're really careful at all the materials we have. So every time we have a material, it's like, okay, which has got the least toxin, which has got the most evidence behind it, which doesn't have fluoride, so we're fluoride-free practice, which is metal-free as well, and actually what works the best. Because there are some materials out there that have got no toxicity or anything, but they haven't got enough evidence on them. So we're always evidence first, then what material can work. And now we've got so many new things out there that can help reverse decay. So there's a product called Icon, there's a product called Avardis, and they're all peptides that we use that actually what they do is we clean the surface of the tooth, we apply them, and it actually helps suck out the calcium and phosphate from the saliva into the teeth. It almost makes the teeth become sponges and hardens them, and it's brilliant. So when you see your dentist and they've taken an x-ray and they see there's some early decay there, rather than actually going in and drilling it, our first thing is like, now you know there's a problem. There's something going on in your cleaning routine or your microbiome or your diet or all three that's caused this to start to demineralize, which is the first stage of tooth decay. And we see that on the x-ray. Now let's see if we can try and reverse it. And we can reverse tooth decay in 3 to 4 months with the right conditions.
Is that a once application by your dentist?
Yes, once application, it's done. It's really, really amazing. So and it's great for us because there's no drills, there's no pain. It's done in one session, and it's got evidence-based. It's from Switzerland, the Vivardis one is, and it means that we don't need to then do treatment. And for us, it's an early warning sign, and that's why I like people to come see the dentist at least once a year, is mouth cancer screening. So we're going to check that to make sure there's any lumps and bumps, but also looking at early disease and like, this is a trigger. This shows you there's something going on. And I think that is something that more and more dentists are looking at that. And things like, there was a study last year it was an Australian and Iraqi joint study where they looked at tongues, and they had 50 tongues, and they used a webcam, so not a high definition camera, just a webcam. And they looked at the tongues of these 50 patients, and they had a database of, I think it's 9,000 patients that had specific diseases that were checked and marked with blood tests and things like that. And what they could do, they had 94% accuracy for checking for anemia, for kidney disease, and B12 deficiency, just from the camera. So they just took a photograph, goes into the AI and says you are 94% chance to have vitamin B12 deficiency.
So
did the blood test, and they were.
What are
It's
the signs
crazy.
of B12 deficiency on the
So
tongue?
colour is different. There's
Colour.
a different is colour, and then also the surface texture is different.
Okay.
And it's clever because for me, I take loads of photos of my patients, but it's still quite tricky because I'm not seeing them for a year and looking at the photos. But with the AI technology that's coming, just taking a photo and putting it into the database and go, this is your photo from last year, the photo there, we see a difference. There's a chance of you being anemic just from the tongue.
Isn't it quite funny though that back in the day you
Yeah.
go to your doctor and they'd just be like, oh, let's have a look at
The
you,
tongue.
and they'd look at your tongue,
Yeah.
look inside your eyes, look
That's
at the
it.
quality of your skin,
Yeah.
because we didn't have as many tests to
Yeah.
go on, whereas now we've got all the AI.
Yeah.
And what are we doing? We're uploading the photographs to get them to actually do it's the old-fashioned way, isn't
It's,
it?
it's Chinese medicine.
hilarious.
It's looking at
Yeah,
the tongue and
it's
saying the
fantastic.
tongue. And the tongue is a barometer generally of health. So we're looking for oral candida, so we can look at thrush on the tongue. We can look at diabetes as well. We get people who come in with recurrent mouth ulcers, and that's showing us there's something else going on. There's zinc deficiency, B12 deficiency, iron deficiency, all from mouth ulcers because we know the mucosa is breaking down. Or your toothpaste has got a thing called sodium lauryl sulfate, SLS, which is like the foaming agent. So if you've got any personal products with SLS in, throw them away, because there's no evidence to show they help. They just foam, especially with the shampoo. It makes everything feel cleaner, but doesn't actually help. It's a cheap agent. It's like a bulking agent. But also for a lot of people, it causes irritation of the mucosa and causes them more likely to have mouth ulcers. And we've got so many patients that I see, they stop SLS, mouth ulcer goes away. But for other patients, they stop SLS, they've still got a problem. We send them for bloods and we find out they're anemic. And then we work with the GP on working on that, ulcers go away. So mouth ulcers is usually a sign that it's something going on in your body health, and
More
we need to work
systemic.
on it. Yeah, it's more systemic, so look out for that.
So if somebody came into you with bleeding gums,
Yeah.
do you always generally then look at all of the barriers, like
Yeah.
thinking about the gut barrier and the blood-brain barrier and other things
Yes.
as well, or is it sometimes a local issue?
So it can be a local issue. I like your question is always generalized to which way. I think I look at the whole picture and I'm looking at everything. So I'm not focusing on the one symptom. I'm looking at all their different symptoms they're going, and I'm trying to connect to their bowel movements. I'm trying to connect to all and saying, okay, what is going on here? And then we start simple treatments. We always start with the most cost-effective, simple treatment, and then reviewing them and saying, has that worked? Has that worked? Has that worked? If that hasn't worked, there may be more of a systemic issue, and let's go on and work on that. But chronic inflammation is a driver for so many different diseases, and if we can simply fix the mouth inflammation and the gum health, for some people it's just changing their toothbrush technique, or for some people it's using an electric toothbrush. It's simple stuff. A lot of us aren't told how to do it, and they're not shown, so we spend a long time going through brushing techniques with people and seeing what works for them, because everyone is different. And for us, it's like if you tell everyone to floss, that is not the best material for everybody. Some people it doesn't work. They're really tight teeth, or they're really crowded teeth, or their manual dexterity isn't there, or they just can't do it. And what we're looking at is what implement can you use in your mouth that causes no damage to your gums or your teeth, because some people are quite aggressive brushers and they can cause the gums to shrink and recede, but also removes the plaque and disrupts the microbiome regularly enough. And the evidence shows it's really every 10 to 12 hours you need to disrupt it, and that's why it's twice a day, and that's why it could be floss, it could be teepees, it could be little interdental brushes, it could be anything. You want something that's a tight fit that sort of mechanically abrades between the teeth. Because if it goes in too easily, if you use a little brush stick in between the teeth and it goes in easily, you'll push the food out, but you won't physically rub off the bacteria, and you won't aerate it. Because what we're trying to do is remove the bacteria on the surface and the plaque on the surface, so oxygen gets back in and the saliva can have its natural properties as antibacterial, and actually to bring the pH back up to neutral. Because that's the thing is, if the plaque sticks between the teeth long enough and you don't get it off, then what happens is it gets more and more anaerobics and more loss of oxygen in there. And then also the acidic environment gets more and more acidic. So therefore, you get holes in between your teeth because it gets more acidic. So if you can clean that off regularly, get the pH back up to neutral, that makes a big difference. For some people, there's a lot of evidence on xylitol. So I like using xylitol on mints and gums. And they've evidence to show that one of the big bacteria for tooth decay is Streptococcus mutans. And if you use xylitol, actually it helps stop the Streptococcus mutans sticking to the teeth, so it doesn't stick as well, and therefore it comes off with the saliva or when you're eating, when you're brushing your teeth, much easier. So using xylitol, gums or mints regularly after a meal that can help increase the saliva flow, but also reduce chance of tooth decay. And if you're somebody that snacks regularly, that's the first thing I want to do, is just try and see if we can reduce the damage that is happening. And then we look at about why you're snacking. Is it because you're not having enough to eat on the main meals? You're hungry? Is it you're bored? Is it just a habit? And what can we look at replacing the snacks?
Interesting. We always look at snacks as well and try and withdraw them and trying to deal with the cravings and the behavioural aspects.
Yes.
Coming from the blood sugar perspective and the gut microbiome and the ability for it to do its housekeeping jobs rather than just constantly be digesting those nuts and seeds or whatever.
That's the thing, because people tend to graze the whole time. It's like, okay, the mouth needs chime for the saliva to re-up. And there's a thing called the Stefan curve, which basically means our pH is around neutral, and every time we eat or drink something, it drops to be acidic. And what happens is it usually takes 30 to 40 minutes to get back up to neutral. But if every 40 minutes you're eating something else, it just stays acidic the whole time. So what we're trying to do is bring that curve up to more neutral, and mean when you have those attacks, they don't last as long. And then how can we sort of make the teeth stronger so they're more resilient to the attacks? And that is cleaning them regularly. That's xylitol, and there's loads of evidence now on hydroxyapatite and how hydroxyapatite actually helps harden the teeth and make it more acidic resistant. So therefore, rather than being sort of dissolved at pH 4, it actually needs to go to pH 3. So it needs to go even more acidic to get dissolved. So how we can sort of build that resilience into our mouth.
So that's interesting. So every time you eat, no matter what food you're eating, you're going to increase the acidity every time. So that's interesting. It's just the frequency is just...
It's the frequency that we're working on. And then also certain foods are obviously more acidic than others. So we're working on that. A lot of my patients think fruit is healthy. Now, fruit is healthy. However, it is acidic and it's full of sugar. And everyone's body works in different ways. So we're getting these different spikes. And I love the continuous glucose monitors. I don't know if you've tried them, but
they're incredible. I use them pretty much every day in practice, I would say. Fantastic.
They're brilliant.
data.
And like Abbott has them. Lingo is great now. And the interesting thing is how the market shifted. So when they first came out, it was all just for diabetics. And it's like, unless you're diabetic, you can't have it. And now they've got more and more tech savvy, and now it's like for everybody. And the Zoe app, and when the Zoe first came out, it was like, okay, this is great. Now people are starting to understand. And the fascinating thing is it's individualized, and they're very cost effective. Just wear them for 2 weeks and actually just see what happens with your body. And it's like, okay, when I have 70% chocolate, I don't have a spike in my blood glucose. But when I have 50% chocolate, it goes crazy and lasts longer. And for me, when I did it, the biggest thing was I had a pastrami sandwich and it went off the roof. And it went off the roof for quite a long time. And I think, okay, what's going on with this? Is it what's in the bread? Is it in the pastrami, the processed meat and the sugar and things? And I was like, okay, I didn't understand that.
You can deconstruct it, can't you? And eat all those things separately and figure
see
out
what works. And then also
experiment.
the layering stuff, when you listen to some of the stuff with the glucose goddess and things like that, is about how do we layer things. And it's like, okay, if I have my veggies first and then I have my protein and then I have my carbs, does it affect me in the same way as having the carbs first and things like that? So, and I think that's the fascinating thing, is listening to our body, because sometimes we can feel it and we know how our energy is and how we feel half an hour after, but sometimes we forget it. So it's like, let's look at it, and these tools are brilliant for us to check.
One of the most exciting things that I've picked up from the continuous monitors is when people have a spike and they're like, I didn't even eat. So what happened? So there's a huge spike and a prolonged spike.
Yeah.
So what were you doing? So I get people to make copious notes through their CGM.
Okay.
And it's usually like, it's that phone call to BT
Okay.
to when your internet's not working, which just happened to happen to me. But, you know, it's stress and the impact, and you can actually see it. You can pinpoint, it's like, oh my God. And that is the most insightful data over and above even what you're eating.
Yeah.
It's fascinating stuff.
And seeing what's going on and wearing wearables and things like that. And I think that is the way forward, and that's what's going to happen. And I was talking to Ollie in the morning on the way here about salivary diagnostics and what we're doing. And we're getting closer to when somebody first comes in and they're going to be spitting in a tube. And within 15 minutes, we're actually going to be seeing their micronutrient status. We're going to look at the pH of the saliva. We're looking at the microbiome and see where the sort of the dysbiosis is. But we'll also be then suggesting the perfect toothpaste for them, for that microbiome, for that period of their life, and saying, this is what we're doing for you and this is why, with the pH and things like that. Actually, eventually there'll be a vending machine that actually it comes out with your 3 months worth of supply of toothpaste in the colour of the tube you want, and that'll be it, you're moving on. I think that's the fascinating thing, because it's getting cheaper and more cost effective and quicker for these tests that are individualized, that we can personalize your healthcare. And then also, what are your goals? Are your goals to keep your teeth forever? Are your goals just to have a nice smile? Are your goals just to get rid of bad breath? So some people come to us, and actually the only reason they've come to us is because they've got bad breath, and their friends have mentioned it to them. It's like, okay, what can I do about it? What is the thing? And okay, now we start delving in a bit more about it. And is it postnasal drip? Is it got acid reflux? Is there gum disease? Is there tooth decay that's happening underneath it? What is happening here? And that's when we're sort of a bit of a detective, and we're looking at all different things and seeing what can we do for them, and making a change to them. It's like, okay, now I've realized there's an importance to my oral health because I'm worried about that. So it's like finding what the driver is for that person at that period, and then giving them the tools to actually monitor it themselves and go forward.
It's really exciting to kind of hear that like visual of what's coming.
Yes.
I feel really excited about that. I mean, I still get quite a lot of people that will come and they'll invest a lot in functional medicine, which is looking at the root cause, the whole lot of everything, incorporating all aspects of their life. But in our intake questionnaire, we have a dental section, and people are often like, what are you asking about teeth for? It's like, but yet you're in the whole, you've bought into functional medicine.
But you've like missed the mouth.
You missed it. It's just missed it. And it's the most significant thing. And I think general awareness is really starting to shift. But I think there's still a lot of people, even the ones that are really in that kind of camp of trying so hard to help themselves and take the health into their own hands, still not quite aware that the mouth fits into the body and it's all connected.
And so for us, it's a big barometer of what is going on generally. And there's the evidence shows there's a bi-directional link with diabetes. So if I have patients that are diabetic and I can improve their mouth health, I'm going to get their HbA1c scores better. I'm going to reverse their diabetes. I'm going to get them off their medication. And that's fascinating for us. And that's been so researched now to see that. And my treatment's going to go better as well. So if they've got gum disease and they're finding that HbA1c is uncontrolled, we can like, okay, let's work on the gum disease, then we can work on that and look and making them realize that actually they can't just carry on eating as they have been in the past, because it's affecting their mouth health and the rest.
So can you, just going back to that then about diabetes, and what treatment specifically are you talking about that will shift the diabetes outside of the dietary change?
Yes, so for us it could be gum disease. So if we've got going on, and that would be, we might do ozone therapy. So that's basically high concentrated oxygen, and we can work on flushing that around the gums, so we can change the microbiome inside the mouth. And then if they've got gum disease and bleeding, we can work on brushing and cleaning. If they've got actual cavities, we fix the cavities because the bacteria are in there and triggering the immune system. So it's actually all of those things. And then also it's sleep apnea as well. So always look at their sleep as well. So looking at what those drivers of inflammation are to see, and can we close that leaky gum up?
Is that the link with the diabetes and how these things really progress the diabetes?
Yes.
It's because of the chronic inflammatory.
Yeah, it's all the inflammatory, IL-17, all that stuff that's triggering, and the cytokine storm, and how we can work on that, because it's just another thing that's pushing them across the barrier. So, and that's really fascinating to work on that. And
one thing I've always thought about is osteoporosis and teeth and how they're related. Is osteoporosis, does that mean if you have that you're more susceptible to demineralization of the teeth? Is
Not
there
the
a
teeth. We find it's the bones. So the osteoporosis of the bones, that we're finding people have more aggressive gum disease. They get looser teeth. If they've got dental implants, they're more likely to get rejected. So that's the big thing for we. So, and for us, the sort of the big marker we always look at is vitamin D. So for all of our patients, we do vitamin D testing, and we can do finger prick testing, and we want to get them 75 to 125 nanomoles per litre. That's our sort of optimal level. And if you look at the NHS guidelines, and some of my patients come on their blood markers and they say it's all fine. It's a lot lower. It's like, this is the level not to get rickets and not to break your bones and fall over. I think you want a bit more than that. I think that, and so I mean, that's one of the big things that I optimize vitamin D, and I'd sort of double the dose at winter time. And I think for most of our patients, that is a big thing. And I think the stats are about 90% of the UK population is vitamin D deficient, and that is the thing that we really want to work on. And we can see a big difference with patients that if we do extractions and their vitamin D levels are low, they get things like dry sockets, which means the area doesn't heal properly. They have much more problems and complications afterwards. So if we optimize that vitamin D level, and we usually add K2 with it as well, because that's another marker for it, we find that really does help. And sometimes we get patients that don't know they've got osteoporosis. We take x-rays and we look at the density, and now we can put stuff in AI and it can look at the density levels of the bone and say, look, there's a problem here, or you've had this tooth out and it hasn't healed properly. I'm worried about this. Let's go and get these markers done. And then we find that there's other issues going on there. So it's looking at what we can do, and we can work with the GP about that and try and sort of push them in the direction of, okay, let's try and start supplementing the vitamin D and K2. Makes a big difference on that. And I think that's really fascinating with our patients, like why they're taking certain supplements and what can we sort of tweak and what can we improve and how can we sort of push them down the sort of the food first, because it's always our big thing is like, what foods are you eating, why are you eating things, and how we can spend as much time and effort on cooking that fits into your lifestyle, because it's got to fit into a lifestyle as well.
A lot of it I find is lifestyle before food and nutrition even, because it's like, you know, what's happening to the farming, the food production, the food supply. Have you got any time? Why haven't you got any time? And like coming back to vitamin D, it's like people aren't outdoors enough. Totally lost the connection with the outside world really and nature. And so, as you say, 90% of us are all vitamin D deficient. It begs the question, like, how are we going so wrong? Not, okay, what dose do I need of vitamin D? Which, yes, you probably do need that. But actually, what can we do with the lifestyle to start reconnecting that and get you natural vitamin D in your body, which is a lot more effective than taking another pill.
If we can, but then it's a matter of, do you go topless at lunchtime and just try and get the sun out as much as possible? And the English people are notoriously pale skin. We notoriously have crooked bad teeth. We notoriously cover ourselves as much as possible and don't go out and don't show flesh at all. So it's like, okay, it's a big cultural shift, and we're not going to do that overnight. And then we're going to then fighting the big pharma, we're fighting the big food, we're fighting all the sort of agricultural process of why a tomato doesn't taste like a tomato in England, but it does in Italy. And there's all these different things. And it's like, okay, well, that's a losing battle almost. So what battles can we work on and what can we do well? And that's that educating that one mother when she's pregnant. It's like, okay, let's look about breastfeeding and the advantages of breastfeeding. Let's talk about when you need to bring in your child to the dentist. Let's talk about how we can do functional medicine, functional dentistry, airway development, and feed them as best they possibly can so they have the best start in life. And that's the thing, is that they come in with a mouthful of old fillings and say, I don't want my son or my daughter to have this. Let's do something about it. And they're the most motivated to make a difference in that generation. And if we can do that and we can help and have no dentistry and just education, nutrition and health advice, that's great. And I think that's sort of really satisfying to work on that. It's like, okay, we don't want to have this problem. And then also there's a genuine fear of the dentist. If you look at sort of what people's number one fear is, usually it's public speaking is the first thing. Probably number two is podcasts. And number three is going to the dentist. And it's like, why are you
That's number one, by the way.
Okay, fair enough. And it's like, why are you fearful of the dentist? And it's, for some people, it's sort of fear of the unknown. They don't know what's going on in their mouth. They're worried about the cost as well. They're worried about pain and injections and what's going on with that. And if anyone's ever had toothache, it's the worst pain in the world. So it's like, how can we avoid that? And I think that's trying to get a relationship with your dentist that, one, you trust them. They're going to be proactive with you and looking at the holistic picture and the whole body rather than just looking for cavities. And what I don't want you to do is you go every year or every 2 years and go, after 6 years, they come in and say, you've got a hole in that tooth. It's like, you must have noticed that in the last 5 years. It doesn't happen that quickly. There's proactive advice, what's going on with their diet, what's going on with the stress, sleep, all the things. And so building that relationship and trust so you can work together on how can we stop it, because that's what we want to do, is work together so you don't need any treatment in that respect. And maybe you want some cosmetic stuff, you want to whiten your teeth or something else like that, great. But it's all about prevention of disease and how can we prevent that, but how can we work on all the other things? How can we give you more energy? How can we get you sleeping better? How can we work on relationships? All these different things we can work on, which is much more satisfying as a practitioner to help with.
Definitely. So if we're thinking about the sustainability of the interventions and things that you're doing within your work, and people think there's a lot of areas, isn't there? Like, we know there's a huge amount of areas to cover in terms of whether you're healthy or not healthy, mouth or otherwise.
No.
Can you think of some things that are just generally good for everybody to do to just improve their oral health?
I mean, a simple thing to do is
Really
tongue
simple.
scraping. tongue scraping. And I'd normally do a demonstration here. I didn't bring a spoon with me, but you don't need any fancy gadgets. You just need a normal spoon. A metal spoon is fine. And that's all you need to do. And once a day, just put it right as far back as you can down your throat, looking in the mirror the first time so you don't gag or feel thing. Gentle pressure, pull it forward once, then do left side, then right side. That's it. 3 scrapes, and that's it.
And what are we doing with that?
What we're trying to do is remove the bacteria in the food on the surface of the tongue. Everyone's tongue has these little hairs like cilia, and what they do is they trap food and particles and plaque. And you're brushing your teeth and everything else, but what's happening is the bacteria from the tongue is then jumping back onto the teeth and the gums and repopulating it. So what you're trying to do is remove the food debris, first of all, so therefore your taste is going to change. And we find that people after about a week of tongue scraping notice taste and their food that is more flavoursome. That's the biggest thing they would notice after doing that. The other thing is what we're trying to do is disrupt the microbiome and get more oxygen in there, because that's the other thing, because we don't want to have anaerobes in our mouth because they're more pathogenic. So we're working on that. So your breath taste is better as well. So it's not only sort of better taste, but better breath as well, but also that we're trying to increase the nitric oxide production. So basically, when we have our foods, they're nitrates, and they're broken down by bacteria to nitrites, and the nitrites are swallowed, and that produces in the stomach, you get nitric oxide. And nitric oxide is this wonder gas that we produce, most people produce, and what it does is it works on blood pressure regulation. So it actually helps work with people who've got hypertension and things like that. It basically dilates the vessels, and it means that our blood flow is better. So we're trying to increase the production of nitric oxide as much as possible, and tongue scraping is the simplest and cheapest way of doing it. So it doesn't cost anything. You can buy these sort of copper scrapers and all these other things, but a spoon just works just as well, and it will last for years and years and years. Obviously, don't share your spoon with other members of the family. Just for you, that tongue. And all my family does it. My 11-year-old does it, tongue scraping, and actually it's quite good fun. We all tongue scrape together. So that's a simple, cheap way of doing it. Yeah, Friday night out, tongue scraping. So yeah, that's one thing. That's a simple thing to do. The other thing we talked about earlier on is about mouth taping. So trying to get people to encourage people to breathe through their nose more. And again, you can use micro to pour. You don't need anything really expensive. I don't like mentioning brands, but one of the ones I really like is a thing called Myotape. And I quite like it because it's got a hole in the middle of it. And what it does is a little plaster that goes over your lips. And what it does is it encourages you to close your lips together, and it helps you build up the strength of that muscle. But also, if you feel that you need to breathe or you need to talk to your partner before bed or something, you can actually open your mouth and still talk and then get back to bed.
So it's a bit less restrictive.
Yeah, it's a bit less restrictive. So you can buy those and you can try different ones on there and so. So I think I really like that.
Is that safe for anybody? So you don't need to know you've got a sleep issue or breathing disorder at all.
No.
It's
I think
anyone can try it, and
everyone can
it
try
just
it.
won't do a lot if you're all good.
Yeah, so if you're breathing really through your nose and everything's fine, it will do nothing. Okay. So apart from make you a little bit less well off by paying for the tape, but you can buy it's a cheap tape. But I think for most people, definitely try that, and I think that's really simple. We talked about continuous glucose monitors, all these other things that are good for using. The other thing for most people, they are not brushing for long enough. So the guidance shows it takes about 2 minutes to get rid of all the plaque and debris on your teeth, and most people don't brush long enough. So for a lot of people, I suggest getting an electric toothbrush with a timer, because every 30 seconds it pulses, and at 2 minutes it shuts off. And for a lot of people, especially men, they tend to be quite aggressive brushers. So you can buy.
They're strong.
They're strong, and they're taking out their aggression and their daily stress on their teeth. So actually getting one with a pressure sensor works really well. So what happens is when you push too hard, either the light comes on or it slows down and stops. So for a lot of people, that's a really good sort of technique just to work on how they can do it and make sure they're not brushing too hard. So electric toothbrush, you don't need to spend a lot. 30 to 40 pounds, you get a really good one. And that really just gets you into that 2-minute breath and making sure you're not over brushing. I think. And then really lastly is using something in between the teeth. And again, there's loads of different things out there, but really finding something that's a snug fit. And for most people, they end up with 2 different sizes. So they have a bigger one for the back teeth and a smaller one for the front teeth, or they floss on the front teeth and use sticks on the back. But using something, and that's when you go back to see your hygienist or your dentist, once they've cleaned your mouth, get them to show you different tools and see which one actually fits the best for you, and then use that regularly. And they last for weeks and weeks and weeks. Again, don't share them with anyone else. They're just for you.
Okay.
Let's talk obesity, shall we?
Let's talk obesity. So how, if somebody's overweight,
Yep.
how does that link to
Yep.
what's going on with their oral
Okay.
health, their teeth and
Yeah.
their gums?
So, I mean, there's two things. There's the common inflammatory pathways that we talked about before. We talked about cytokine storms and things like that. So that's the first thing. And also there's the common lifestyle factors that we need to deal with. So that may be constant snacking. It may be that they're under stress. It may be their sleep is disordered, things like that. So we're looking at it may be they're just not moving enough time. So it's actually looking, when we do an examination, when we're talking to somebody, I spend an hour at the beginning. We want to go through all their lifestyle factors and see what is going on. And we're getting more and more patients now on Mounjaro and all these other suppressives. And we're thinking, okay, what can we do about it? And how can we help them? Because it's all, for me, when they're on these sort of things, it's all about a transient process to try and then get onto real food and to learn habits and to have healthier lifestyle things so they're not on it for life. Because that's what we don't want to do. We want to actually just help them recover on their own. So when we get somebody obese there, they are interested in losing weight. They're interested in getting healthier, and they want to, what can we do to help? Are we being the health coaches to give them a barometer to say, when they first come and see me, we do a thing called a bleeding score. So we look at actually how much inflammation is in their mouth, and we give them a percentage. So we say, okay, when we last saw you, Julia, we had 27% bleeding. We want to get you under 10%. That's our target. So you're going to see the hygienist. We're going to go through brushing and cleaning and tongue scraping, all those good stuff. And then we're going to see you again in 6 weeks' time, and we're going to redo that bleeding score. And we're going to see, does that bleeding score go down? Okay, this is good. We're working on fixing the barriers. It hasn't not gone down. Okay, it hasn't gone down. You're doing all the right things. What is going on? So it could then be the snacking and the fact that there's not a chance for the saliva to repair itself. So we need to try and work on increasing the frequency between meals and snacks. That might be it. It might be that they need a boost to get that inflammation down. So it might be to say to them, actually, we're going to add CoQ10 into your supplement plan. We're going to do something to help the inflammation. We are going to do a short course of chlorine dioxide mouthwash to see if we can reboot the microbiome. What can we do to see if we can just push it over the edge and also feel like you're getting a win? Is there a progression? Is your breath getting better? Are you getting less bleeding? Are you getting less sensitive teeth? Because that's the other thing that we didn't talk about, is about sensitivity. Because as we get older, our gums can naturally recede. And if you're overbrushing, the gums can recede. And if you've got inflammation in your mouth, the gums can recede. So a lot of my patients come with me, and one of the signs is I've got really sensitive teeth. I can't drink cold things straight from the fridge. I find that when I have any fruits, my teeth are sensitive afterwards, or they feel like there's a slime on them or something. And then we start having a look, and we take photographs first of all, so we've got a benchmark of where their gums are. So what I want to do is first of all make sure they don't get any worse and they don't shrink anymore. And then we look, when the gums do recede, the root is exposed, and the root is what we call dentine, and it has lots of little micropores. And what happens is then, if you have constant snacking, or you have quite an acidic diet, or we talked earlier on about the Stefan curve and the acidic, those pores are constantly being opened, and therefore your teeth are always on edge. They're always sensitive. And for some people, actually, they think they're doing all the right things, but they're having carbonated drinks, and it's just water. And they're having fizzy water, and they think, oh, that's much better than Coke and all these other things, which it is. However, it's got carbonic acid in, and the pH of a lot of the fizzy waters is sort of 1 or 2, and that can cause demineralization and cause sensitivity. So it's like, okay, what can we do? Short term, it might be making sure their toothpaste they use it as a smear. So if there's certain sensitive teeth, every night before bed, they get a bit of the toothpaste and smear it onto the area, which helps block those pores. And usually with the hydroxyapatite in the toothpaste helps block it. But then it's also, what else can we do? Can we do hydroxyapatite varnishes in the chair that we paint on that last longer? Can we look at what their snacking is like, and so we can change it slightly so we can work on that together, and they can say, oh, well, that tooth's not so sensitive anymore, and what's going on with it. And I think that's it's exciting how we can work together, and why have they come to see us in the first place? What is their goal, and what quick fixes that we can do simply and not invasively. And that could be that suddenly they're able to eat apples again because they haven't been to before because their teeth are too sensitive. It could be apple cider vinegar. So I know you have a product, apple cider vinegar. So I get patients who have apple cider vinegar, or they have honey and lemon, or they have lemon in the morning, and things, which all of these things have got loads of evidence. They're great for digestive enzymes. They're great for digestion. They are really bad for your teeth.
So when the apple cider vinegar is diluted
Yes.
very well, so
Yes.
say 2 teaspoons in about 100 to 150 mils of water,
Nice.
is that still very bad for your teeth?
No.
Because I think a lot of times when I've talked to dentists about it, they think that you're swigging out of the bottle, which is
Yes.
obviously extremely high acidity.
Yes.
But when we're diluting it in the way that is optimal for supporting your
Yes.
digestion and
Diluting
Is
it that much, then it is the damage is very minimal. And then I always say to people, if once they've had apple cider vinegar or a sort of lemon or anything, quick swill water afterwards to try and neutralize the acid. Some people, xylitol gum or sugar-free gum as well to increase the salivary flow to wash it away. If you have it with food afterwards, then there's no harm at all to your teeth.
Usually we advise people take it just as they're preparing their meal,
Yes,
so that
okay.
it optimises the digestion
it's on
and
an
doesn't
empty
stay on the
stomach.
teeth.
Yeah.
And if people have got really poor enamel and their
Yeah.
dentist has said that,
Yeah.
would drinking it through a straw make any difference?
Yes, it does. So drinking
It
it through a
does.
straw will then emiss the front teeth as well. So it will still affect the back teeth. But the biggest thing is to neutralize that acid as soon as you can on the teeth. So a quick swill water for 10 seconds, and that's enough you need to do.
Is
So-
coffee acidic on the teeth?
No. So the coffee will cause staining. So you're okay to have your coffee. It's what you put in the coffee. So the sugar is the problem. But yeah, coffee on its own is fine, but it's the staining of the teeth. And also what we're looking at is also energy levels throughout the day. And if you're having coffee in the evening, then the half-life is 8 to 10 hours and it's going to affect your sleep and things like that. So we're looking at the whole lifestyle hack and saying, okay, why are you having the coffee? Is it because you enjoy the taste and the flavor and having a coffee with somebody? Or is it the fact you need the caffeine to stay awake and to keep your energy levels? And that's a part of the bigger conversation. But apple cider vinegar, no problem at all, as long as you're careful with acidic. And there's anything acidic as well. Think about apples. And the fact that some of our patients have a lot of fruit thinking it's healthy for them, but you're still getting this
Sugar
glucose
spike.
spike. And that's the thing, is like a handful of it, it's once a day ideally, and then looking at what you do afterwards and how it makes you feel and how your body responds to that. And obviously we're wanting patients to go to more real and whole foods as much as possible, because if you like apple juice, you can juice 20 apples and drink it all and not feel full, but you're going to have a massive spike in your blood glucose level. But if you can't really eat more than 2 apples because of the fiber and everything, it fills you up and you feel more satiated. So it's like having whole foods if we can, not juicing them. And whenever our patients are on juices, we try and push them more to a sort of vegetable-based juice rather than just a fruit-based juice because of the acidity and the sugar as well. Yeah.
So we've had some questions from the gutology community about oral health aspects.
nice.
So somebody is suffering from bleeding gums and receding gums.
Yep.
They've been using gutology toothpaste now for 4 months, and
Yep.
it is improving, but it's
Great.
not gone. Is there anything else that they can do to help? This person is also going through the menopause and has noticed the issues have happened whilst this has begun.
Okay, so obviously there's a lot going on. Great question. So I think the first thing would be get some photographs if they've got photographs from their dentist, or go in and get some photographs to see where the gums are receding, see what levels they are, and see if there's any particular areas that are receding. So some of the receding gums may be from gum disease. Some may be they're overbrushing. So again, we find that people in the corners around the canines and the premolars, they can sort of brush around the corner and they get more leverage on, and it might be that. So it might be that actually see if there's a particular area. Some people are actually just one side of the mouth is receding more than the other, and that's because they're clenching and grinding at night, and they may have one side of the mouth that they're grinding. And subconsciously, if your bite is not even, at night you sort of tend to move your jaw around and try and find a comfortable position. So it might be for them that either they need to have their bite adjusted slightly, wear a mouth guard to protect their teeth and to give them an even bite, or it may be that actually there's something else going on while they're grinding, and that could be stress related. We talked about micronutrient deficiencies as well. So especially if they're going through menopause, there's obviously loads of hormonal changes and things happening. Maybe their sleep's not as good as well, which just means they're grinding more because they're not going into deeper parts of sleep, so therefore they're clenching and grinding. So I would look at blood markers first. I'd get some photographs to see where the gum levels are and see if there's any pattern that we're worried about. And then, again, first thing is to stop it getting any worse. And then maybe making a mouth guard if they're a clencher or grinder, just to protect your teeth and act like it's a shock absorber.
And what impact does the hormone changes have on the gums?
So we're finding that we find that they get more inflammation, and we find that the treatment doesn't work as successfully when their hormones are all over the place. So it's actually trying to get some stability there, and we're getting more gum inflammation and quicker gum recession as well. So it's actually just getting that getting on board with that as well.
Okay. The next question, there's some similarities here. So we might just need to kind of add to what we just said. They have gum disease despite very carefully looking after my gums, religiously brushing and using a water pick. However, wondered if there's any other way I could prevent tooth loss as they lost a tooth earlier this year.
Okay.
And the dentist has just shrugged their shoulders.
Oh dear.
She's
I hear that a lot.
Yeah, she's age 65, if that makes any difference.
Yeah, I mean, we shouldn't be losing teeth after sort of 18, that's it. Well, most people all their baby teeth have gone. They shouldn't be losing any teeth now. So really, if you're losing a tooth, you want to find out from the dentist why I'm losing it. I mean, there are accidents. People fall over and knock things. People bite on olive stones and crack teeth, so they can be lost. But we want to find why they're lost in the first place to see on their risk categories. Some people lose teeth that have been dead for years and they've had a root treatment and then they've broken from that respect. So first of all, find out what is causing it to break in the first place and why they had to have it removed. And again, some dentists are more proactive than others, and some of them just wait till something's broken and actually then looking more deeply. She might have been clenching and grinding her teeth for 20 years, and then eventually there was a tooth with a big filling, and eventually it just cracked and broke. So I think find out about why it lost in the first place, and then look at what we can do to stop losing any more. And the tricky bit when we lose teeth is the gum will then shrink. The bone will then shrink because you're not actually using it, and the teeth either side will change. So often your bite will start to change. So the tooth behind the gap, if there is one, will start to tilt forward. The tooth, they say it's a lower tooth, the upper tooth will start to grow down into the back, and suddenly her bite will change, and then other issues are going. So I would always find out why you lost it, and then what can you do. And it might be something as simple as making a retainer to wear at night, just to hold that space to stop it going anymore. She's still young, so it might be looking at putting a dental implant or something to replace the tooth that's missing to stop the teeth either side moving into place. So we don't want to lose teeth, but if they have to come out, then it's how can we take them out in the sort of most preventive biological way, making sure that you remove the ligament properly, because that's the other thing that's happening more and more now. In America, we're noticing things called cavitations, and basically it's areas of dead bone. And what's happening is when a tooth's taken out, often a wisdom tooth, that the dentist is not cleaning it properly afterwards. So they're leaving areas of ligament, which is the fibre that holds the tooth into the bone. They're leaving it, the gum closes over the top, but the bone never fills in. And especially if they're mineral deficient, it doesn't fill in properly, and therefore they have these areas of dead or necrotic bone, which then are triggers for chronic inflammation, and we call them cavitations. So that's something that is picked up on a special scan. We do things called a CBCT, which is a 3D scan, and we can actually have a look and see what's going on. If the bone density is not right, then we can go back and clean it out properly.
Is that a cone beam?
Yeah, cone beam X-ray. And then, but nowadays with dentistry, we can sort of target them to just small areas in the mouth, sort of 3 or 4 centimeters in diameter, so we don't have to irradiate the whole jaw, and we can have a look. And then actually, there are also blood tests. There's a blood test called a Ranchi's test, which we can do and actually looks at the cytokines and looks at inflammatory markers specifically for dead bone, and it can then show us if there's high and if you are a high chance of having a cavitation, and then at that stage we either clean it out surgically or we use ozone to disinfect it. So really important. Hopefully you don't need a tooth out, but if it's taken out, if you do need it, make sure somebody is careful, take it out, clean it, make sure they disinfect the whole area before they close it up so it heals properly, and that's really important.
Okay, so the crucial thing here is to really understand why. Yeah, same with every health question,
it's
isn't
like,
it, really?
why are you losing? I mean, if you're losing any other part of your body, you'd freak out. If a finger suddenly dropped off or you had to have it extracted, you're like, okay, I've got another 9 left. I want to make sure I keep them. So.
Okay, next question. What would you recommend for somebody grinding their teeth other than a mouth guard if they're already using one?
Okay, fine. So grinding the teeth, first of all, we need to find out why they're doing it. So some of them is micronutrients, and there's a whole load of different things. So there's zinc, vitamin B12, and vitamin C, and vitamin B. What's the last one? Come to me in a minute. I'll put it. Magnesium. That's it. So we'll put it on the show notes, but what to look out for. But I would do the blood test first to see if there's any deficiencies on there. And then also find out when they're grinding. So some people do it during the day when they're really focusing on a task, they're doing emails, things like that, and they clench and grind. So it's that. Other people, they're doing it at sleep time. and it could be a sign of sleep apnea. So we do that. So we'll do an overnight sleep test to see what is happening and when they're doing it and how often it is, and see it's the body trying to get more oxygen and trying to breathe up. So that might be it. And at other people, it's purely stress related. So it's actually just finding out when they're doing it, how often they're doing it, and then why they don't like wearing a mouth guard, because a lot of people, mouth guard is the most cost-effective way of protecting your teeth. It's like it's a barrier to protect it and stops you damaging any more teeth as well. So that might be a thing, but finding out why. And it might be they're not finding it comfortable to wear because they're actually they've got sleep disordered breathing. So actually having something else in their mouth means they can't get enough air in, and it's irritating them even more. So I think an overnight sleep test will be a good test to start with.
So the most important question anybody listening that has concerns can ask themselves is why, and keep asking why until they get to something tangible that they can start to change.
Yes, and it said blood test first, looking at overnight sleep test, seeing what's going on with it, and then checking the muscles themselves and seeing if they're clenching during the day, because often you can find if you're doing it on one side than the other. And also the bite, if the bite's not quite right, and maybe for like the lady you talked about before, if they've lost a tooth, never been grinding at all, then 6 months later the teeth move slightly and they start clenching and grinding because their body is trying to find that missing tooth and trying to get your teeth to meet together properly.
Your body's always trying to work to its best, isn't
Yes,
it? It's like give it any situation, it will figure it out.
It's trying to fall on its feet.
So a question about breastfeeding. Can breastfeeding weaken the mother's teeth by nutrient deficiencies?
Okay, I haven't had that. But what I have had is that when people are breastfeeding, they tend to snack more often. They tend to have high density sugary snacks and things to keep their energy levels up. And they tend to do all the time because they've got a young baby, they don't have much time. They're just breastfeeding and getting the energy and fuel in as quickly as possible. And that's what's causing problems with tooth decay. And there's this funny old wives' tale that whenever you have a child, you lose a tooth. Well, you shouldn't lose a tooth. So gum disease can get much worse when you're pregnant because of the hormonal changes.
The stress of parenting that you lose your teeth over, not the breastfeeding.
Not the breastfeeding, but yeah, breastfeeding is great and do it as long as you possibly can. But think about brushing your teeth and having time to brush between snacks and cleaning. And if you don't have time to brush, xylitol gum or mint as well, just to help neutralize the food and the sugar and to neutralize any sort of acid attack as well if you can.
Okay, lovely. Me and my kids keep having black stains. How can we remove them?
Ooh, okay.
What could
black
cause
stains.
that? Yeah.
So we'd have to look at their diet, first of all, and see where the stains are, because you might all be having coffee every morning and the stains are just from that. We actually have people that have stains from supplements, so especially B vitamins, and some supplements can cause staining from the teeth. I've had patients who've had staining from using chlorhexidine mouthwashes. There's a product called Corstil, which is quite popular. You can buy in a lot of supermarkets, and people use it from gum disease. It's a great antimicrobial, but it kills everything. Again, it should be only used for short-term use, and that can cause staining of certain bacteria in the mouth as well. So just seeing where the staining is, and then also how often it's coming back, because sometimes they haven't seen a hygienist have their teeth cleaned for years. Once they're cleaned, it never comes back. But then other people get it regularly, and we actually see what is going on. Is it something dietary? Is it a supplement or a food thing that's causing it? Is it a habit they do? We get people who have more stains on the mouth if they're mouth breathers, because the saliva and everything dries out, and we get more staining on there. And we also get people who get more staining when they've got gum recession. So when the root's exposed, the root or the dentine is more porous, so it picks up stain as well. So looking at all of those things. But if it's a family thing, it's probably either your family are all taking the same supplements, or it's a dietary thing, or you're all
the behaviours.
Yeah, or you're all mouth breathers. So we need to work on that. Everyone's snoring in the whole family, so no one notices. So
it's working out what they've all got in common, isn't it?
Yeah, it's working out common and having looking at the dentist and seeing. And then if you do get regular staining, we get people who wear bleaching trays and they just put some gel in it and they wear it for half an hour once a month, and that just removes the staining. It's just superficial.
Okay. All right, lovely. Thanks, James. Lovely discussion with you.
Cool.
Really exciting
Thank you very
stuff.
much. Hopefully, lots of different tips and tricks and.
Absolutely.
If you'd like to share your health story with us, head over to gutology.co.uk, join our mailing list, and stay connected for future podcast opportunities and updates. And a huge thank you to Julia and James for another great thought-provoking episode. You can follow James at James Goolnik. He's very active on socials, and learn more about his work at Optimal Dental Health in London. And as always, keep up to date with Julia at juliadavies_nutrition. Thanks for tuning in and being a part of the Gutology community. We will see you next time.